This medication is commonly used to alleviate mild to moderate pain, such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, and cold/flu aches and pains. It is also used to reduce fever. The recommended dosage for infants is 160 mg per 5 ml of oral suspension. It is important to follow the dosage instructions provided by your healthcare professional. This medication can be taken with or without food, but it is important to take it at the same times each day. When using Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension non-opioid analgesic/antipyretic, non-salicylate, always follow the instructions on the product package. Make sure to use the correct dose for your child's weight, and do not exceed the recommended amount. Shake the suspension well before each dose, and use the provided measuring spoon or dropper to ensure the correct dose. It's important to use pain medications at the first signs of pain for the best results. Do not use this medication for fever for more than 3 days unless directed by your doctor, and for pain for more than 10 days in adults, 5 days in children, unless directed by your doctor. If your condition worsens or if you develop new symptoms, consult your doctor. Remember, if you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects from taking Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension, be sure to contact your doctor or pharmacist right away. However, most people do not experience serious side effects from this medication. In rare cases, a very serious allergic reaction may occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your healthcare provider. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. It's important to be careful with the amount of acetaminophen you take, as taking too much can cause serious liver disease. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day, and people with liver problems and children should take less. Make sure to ask your doctor or pharmacist how much acetaminophen is safe for you. Also, be cautious about using other drugs containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medications, so always check the labels and ask your pharmacist if you're not sure. If you think you've taken too much acetaminophen and experience symptoms like nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine, seek medical help immediately. And don't forget that daily alcohol use, especially when combined with acetaminophen, can harm your liver. It's best to avoid alcohol when taking this medication. Before taking Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension, it's important to talk to your doctor or pharmacist if you have any allergies or medical conditions, such as liver disease or regular alcohol use. This product may contain inactive ingredients that could cause allergic reactions. If you have diabetes or phenylketonuria, PKU, you should use caution with liquid products, chewable tablets, or dissolving/effervescent tablets and powders that may contain sugar or aspartame. It's also important to consult your doctor if you are pregnant or breastfeeding before using this medication. It's important to be aware that Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension non-opioid analgesic/antipyretic, non-salicylate may interact with other medications, which can affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, potentially leading to false test results. It's important to inform lab personnel and all your doctors that you are using this drug to ensure accurate test results. If someone has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, residents can call their provincial Poison Control Center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Acetaminophen, the active ingredient in Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension, is a non-opioid analgesic/antipyretic, non-salicylate medication. It does not cause stomach and intestinal ulcers like NSAIDs do, making it a safer option for pain and fever relief. However, it does not reduce swelling like NSAIDs do. It is important to consult with your doctor to determine if this medication is the right choice for you or your child. The recommended dosage for infants is 160 mg per 5 ml, and it can be given every 4 to 6 hours as needed. It is best to give this medication with food or milk to help prevent stomach upset. Always follow the dosing instructions provided by your doctor or on the medication label. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. It's important not to take double the dose to make up for the missed one. When it comes to storing Kindermed Infants Pain Fever 160 mg per 5 ml oral suspension, it's important to keep it at room temperature, away from light and moisture. Be sure to store it in a place that's out of reach of children and pets, and definitely not in the bathroom. When it comes to getting rid of this medication, don't flush it down the toilet or pour it down the drain unless you've been specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're not sure how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.